Hi everyone, so my name is Nicole Murray and I'm a research assistant with the Sexual Behaviors Clinic at the Royal Integrated Forensic Program. And today I am here to talk about one of our ongoing research projects called Atypical Sexual Interest and Anxiety Symptoms in the General Population. So first, just a little introduction on our research. So it really came out of looking at the literature and finding that there was a lack of research examining atypical sexual interest and the correlation between that and anxiety in the general population. So it's mostly focused on forensic and male populations. So the main goal of this research was really to fill that literature gap. And additionally, research has demonstrated that patients with comorbid mood disorders and atypical sexual interests, such as paraphilias, for them, antidepressant treatment may be more beneficial as a pharmacological option than our typical anti-androgen medication. So we really wanted to see if there is a general correlation in having anxiety and having atypical sexual interest. So that brings us to the current study, where our primary objectives are to find the prevalence rate of atypical interest and different kinds of anxiety symptoms in the general population. And then we also want to gain a better understanding of the relationship between anxiety and atypical sexual interest and examine the role that criminal history plays in this relationship. So how we are answering our research question is through a cross-sectional online survey using checkbox survey solutions. And our target sample size for this survey is going to be 800. And these participants will be recruited through Instagram advertisement. So our population that we're looking for is older than 18 years old and living in Canada or the United States. So pretty broad inclusion criteria. We're using 5 scales in this research. So first, we're just looking at demographic variables, and that does include a question on their criminal history. And then we will be using the paraphilia scale. So that really asks individuals about their sexual interest in a variety of different atypical sexual interests. So this includes your bondage, masochism, foot fetish, as well as pedophilia and urophilia, which is interested in your urination. So a bunch of different sexual interests. And then we also are using 2 anxiety measures. So the first one is the Anxiety Sensitivity Index, and the second one is the Beck Anxiety Inventory. Additionally, we're using a mind wandering scale because we are curious about the impact of mind wandering in this relationship, as well as the sexual distress scale, which really asks participants about their anxiety related to sex in particular. And while we have not launched on Instagram advertisement yet, we do have 50 participants that we got through free online survey recruitment. So the mean age of this population was 32, and 65% of the participants so far have been female, which is encouraging because one of the main goals of our research is to find out more about the female population in this area. So just some fun, interesting facts is that the most common fantasies to be reported so far have been sadism, masochism, and feet. And 50% of the respondents have sought treatment, medication, or therapy for anxiety symptoms, which is a little bit higher than is typically reported in the general population. So we will see if this continues to be a trend when we get more responses. Interestingly, out of the 50, 4 respondents have actually indicated some arousal to children. And altogether, we have had a non-criminal sample so far. So only 1% of our sample has been criminalized, and that was for a non-sexual offense. So while we launch on Instagram this coming week, we are definitely excited to see if these trends continue or if they change based on a higher sample. So the next steps, like I mentioned before, we are launching on Instagram, and then we will be analyzing the data and disseminating findings via publications. And although this survey is really asking the general population, it does have very relevant implications for our clinic at the Sexual Behaviors Clinic. So it's going to inform the potential use of antidepressants. It will also give us a better look into the interest of women. And finally, the results of this project will also contribute to the ever-growing literature on mental health comorbidities. So as I wrap up this poster presentation, I would like to invite you all to participate in the survey if you would like by following the link on the poster, and I invite you to contact me with any questions, as well as thanking you for listening to me. So have a great day.